Today we're going to look at the skeleton, minus the skull that we've already studied, but it's divided into two major regions. The axial region, including the vertebra, the ribs, and the pelvic bones. And then the other portion is the appendicular region, which are, the word append means to hang, and so the arms and legs that hang off the axial region. Looking at the skeleton, you see the red and blue painted on the skeleton, and those indicate a muscle attachment we'll talk about later. Starting with the rib cage, we have the sternum, or the breastbone, that's divided into three bones. The top one being the manubrium, the middle being the gladiolus, or body, and the very bottom portion being the xiphoid process. And of course the ribs attached to the sternum, all directly or indirectly. The first 7 ribs are referred to as true ribs because they directly attach to the sternum. And then we have 3 false ribs that indirectly attach to the sternum. And then down below we have 2 floating ribs that don't attach at all to the sternum. Looking at the vertebra, or vertebral column, or spine, or backbone, but the series of bones in the posterior portion of the skeleton is divided into different vertebrae. All of them form a double S shape that allows us to walk upright. But the first 7 vertebrae are the cervical vertebra, and then the next 12 are thoracic vertebra, and then the final 5 are the lumbar vertebra, before we get to the sacrum, which are 5 vertebrae fused to form one solid plate in adults, and then finally the remaining 4 vertebrae that fuse to form the coccyx, or the coccygeal vertebra. Now we're going to look at the individual vertebra. We'll start by looking at a typical vertebra, meaning any one of the vertebrae has certain features, and the body is the major portion of the vertebra. And again, those are separated by intervertebral discs made of cartilage. And then the vertebral foramen, where your spinal cord resides. And then the spinous process is what sticks out the back. Of course, you can feel those, the spinous process. And then we have transverse processes that stick out the side. And then we have a superior articulating surface and an inferior articulating surface. And of course, those interlock with the vertebra, the superior with the vertebra above it, and the inferior with the vertebra below it. Then let's go through the other vertebra. Let's start with the cervical vertebra. Again, we have 7 cervical vertebrae. And the key feature of cervical vertebra are they have these holes in the transverse process known as transverse foramina, plural, or transverse foramen. And so anytime you see that transverse foramen, you know that's a cervical vertebra. Starting at the very top cervical vertebra is called the atlas. Again, having the transverse foramen and a huge vertebral foramen and no body. So this allows for the larger spinal cord or brainstem to taper into the spinal cord. So that's the atlas. And the occipital condyles of the skull articulate with the superior articulating surface there of the atlas. The second vertebra, the atlas, is known as C1. The second vertebra, known as C2, is the axis. And the key feature of the axis is this odontoid process, or dens. And it sticks up, and its function is to allow the first and second vertebra to rotate on that odontoid process, or dens. Again, going down to another cervical vertebra, again looking a little bit different. It does have a body. The vertebral foramen is being small. The vertebral foramen being smaller, and again having those transverse foramen that we mentioned that allow blood vessels to flow to the head. So we have 7 of the cervical vertebra, and then we go to the thoracic vertebra. The thoracic vertebra is often described as looking like a giraffe, and the giraffe appearance is from the long, extended spinous process. And then also thoracic vertebra, of course, we have 12, and we have ribs that attach to each of those vertebrae. And here we can see these 2 flat areas, which are the rib facets, and so a rib articulates with the thoracic vertebra there. So thoracic have long pointed spinous processes. They don't have the transverse foramen, and again, sort of resembling a giraffe. Below the 12 thoracic, then we have the lumbar, 5 lumbar vertebra. This is to resemble a moose. Here we see the snout of the moose. So again, we don't have transverse foramina. We do not have a long pointed spinous process, but a thicker, bulkier spinous process, again, for more muscle attachment for those weight-bearing lumbar vertebrae. So the remaining two types of vertebra is the sacrum, which is 5 vertebrae that fuse to form one. So this solid bony mass here is the sacrum, and then right below it are the remaining 4 vertebrae that fuse to form a coccyx or coccygeal vertebra. Looking at the sacrum, we have the median sacral crest, which are comparable to the spinous processes of the other vertebra, and then the sacral canal. The spinal cord doesn't go down there, but spinal nerves do, and the sacral hiatus, and then the posterior sacral foramina. Looking at the entire pelvic girdle, we can see that this is a male pelvis and the female pelvis. Again, there are many ways to distinguish the two, but the most obvious is the angle of the pubic arch. Here in the male, we can see a very narrow angle, and again in the female, a much wider angle of the pubic arch in a female pelvic girdle. Looking at a single pelvic bone, or an innominate bone, or os coxa, all names for the same bone. It's actually 3 bones. The top portion of the bone is the ilium, and then the part with the larger portion here is the ischium, and then the pubis. So three bones making up this pelvic bone: the ilium, the ischium, and the pubis. And the parts of it, on the ilium, the top portion is the iliac crest. The very front part is the anterior superior iliac spine. Moving down, then, where those 3 bones come together, forms the acetabulum, which means vinegar cup, and the head of the femur goes in there, and then the large opening known as the obturator foramen. In the ischium, we have the ischial tuberosity, this big enlargement, which is really what we sit on when we sit on a chair. We're sitting on our ischial tuberosity, and the smaller ischial spine in the back. From the pelvic girdle, then moving down the leg, we have the large femur. This is a right femur. The head of the femur that goes into the acetabulum we mentioned. And in the head of the femur, we have a fovea capitis, a tiny pit. This is the neck of the femur. And then 2 large processes. We have the greater trochanter and the lesser trochanter, places for muscle attachment of the gluteal muscles. And then down we have a patella that normally tracks in this groove. This is the patellar surface. And then we have the lateral condyle and the medial condyle of the femur. Moving down, the 2 lower leg bones, we have the tibia, the larger bone. Some people remember the tough tibia, the bigger one. And we have a tibial tuberosity right here for the patellar ligaments to attach. And then we have the medial malleolus. Again, this is a right tibia, so that's your inside ankle bone that you can palpate and easily feel. Below that then, or not below that, but lateral to that, would be the fibula. Some people say fragile fibula. It's a thinner bone. And the 2 parts of the fibula are the lateral malleolus, which is down here, and that's your outside ankle bone. And then at the top, we actually have the head of the fibula. So, sorry, but the head at the top, at the knee joint, and then the lateral malleolus down at the bottom, your outside ankle bone. Here we're looking at a right foot. The 3 main regions of the foot are the tarsal bones, or the ankle bones, the metatarsals, and they're numbered 1, 2, 3, 4, and 5. And then the phalanges, also numbered with the big toe being 1, 2, 3, 4, and 5. The tarsal bones, the biggest tarsal bone is the calcaneus, the heel bone, and then the talus, and your tibia articulates with that talus. The navicular, shaped like a canoe, that word means canoe. And then we have 3 cuneiform bones, the medial, intermediate, and lateral cuneiform. And then we have this cube-shaped bone called the cuboid. Again, we mentioned the metatarsals, and then eventually the phalanges. And the phalanges are divided into the proximal, the middle, and the distal phalange, or sometimes called phalanx. The 4 outer toes have a proximal, a middle, and a distal. The large toe only having a proximal and a distal phalange. Going up to the pectoral girdle, then we have the two bones, the clavicle and the scapula. They articulate so. This portion of the clavicle would articulate with the sternum, so this is just the clavicle. And then this part that articulates with the clavicle is the acromion process. And moving this around, this is the coracoid process that doesn't articulate with another bone but is an attachment for tendons of the arm. This is the glenoid cavity or glenoid fossa, and the head of the humerus goes there. And this is the spine of the scapula. So this is the head of the humerus where it articulates with that glenoid fossa. And looking at the humerus, in this case we have a left humerus, and here's the head of the humerus, and the 2 landmarks on this side of the humerus are the greater tubercle and lesser tubercle, and then the intertubercular groove. This is the head of the humerus, and right below the head is the anatomical neck, and down where it narrows quite a bit is called the surgical neck, because that's where we often break the humerus. We also have, again, this is the outer portion of the humerus. We have the deltoid tuberosity. It's just kind of a rough area, and it's for your deltoid muscles, your shoulder muscles. It gives a nice place for them to attach. Then on the distal portion of the humerus, we have the 2 condyles. They have specific names. We're just going to refer to them as condyles. And then above them, the epicondyles. So condyles and epicondyles. This would be the medial epicondyle, and that's your funny bone. That's where sometimes you hit it. It's not so funny, but it's called the funny bone, the medial epicondyle and the lateral epicondyle. And then in the front we have a small indentation, which is the coronoid fossa. And in the back, or a much larger one, the olecranon fossa. And that's basically where your elbow, your ulna of your elbow goes into that olecranon fossa. Looking at the two forearm bones, again, distal to the humerus, are the radius and ulna. The ulna kind of has this scoop that looks like a U. Some people use that to remember. The other being the radius that attaches to the thumb side on the forearm. Let's start with the radius. And the proximal end of the radius is the head. And then we have the radial tuberosity. Your biceps tendon attaches there. And the ulnar notch, kind of a notch for the ulna. And then the styloid process. Again, you can palpate on the thumb side of your wrist and feel that. Looking at the ulna, again, the portion that sticks out in the back is the olecranon process that goes into the olecranon fossa of the humerus. The trochlear notch, this kind of notch, the U-shaped portion. And then again, we have the styloid process that you can feel in the little finger side of your wrist. And this is the head. The distal portion of the ulna is the head of the ulna. Moving down below then, the forearm bones were to the hand, and similar to the foot, we have 3 regions: the carpal bones that make up the wrist, the metacarpals, again numbered from the thumb as 1, 2, 3, 4, and 5, and the phalanges also being numbered 1, 2, 3, 4, and 5. The carpal bones, we have 8 carpal bones, and starting from the thumb, this is the trapezium, the trapezoid, the capitate, hamate, scaphoid, lunate, triquetrum, and then kind of not in line is the pisiform bone. Then again we have 1 through 5 metacarpals, and then phalanges, again like the foot, the proximal, the middle, and distal phalange.